Dr. John, a lot of our clients recently have had post-traumatic knee injuries that have ended up here in a knee replacement. I see Chapter 2520 deals with a lot of the references to knee and knee injuries. Could you please share with us and help us with that model, understand a little bit about the knee?
So one of the things that happens with a wide variety of types of knee injuries, so if people have heard of ACL injuries or patellar injuries or meniscus injuries. So what we're looking at here is a model of the knee. And if we take away all the muscles in the skin, we can actually pull the kneecap apart and then look inside the knee itself. Okay, so when people have these types of injuries, the reason that they're significant is because if they're not treated properly, or if they're so severe, what can happen is people develop what's called post-traumatic arthritis. Arthritis has to do with the lining of the knee. In this case, in this model, the blue part is the cartilage, and that's the lining of the knee. When the meniscus, which is right here, or the ACL gets injured, that also contributes to the wearing away of that lining. And that when that wearing away occurs, when it gets all the way down to bone on bone, that's when people typically will need a total knee replacement.
For those people who are suffering from post-traumatic arthritis, does it ever get better over time?
Post-traumatic arthritis will never get better. It's a progressive type of condition, meaning it can feel better sometimes, it can wax and wane, but at the end of the day, long term, it will get worse.
I mean, I imagine that on the spectrum, going in for total knee replacement is the extreme. What can they do to treat your post-traumatic arthritis in the knee?
You're right. There's different options as far as treatment for post-traumatic arthritis. The initial option is activity modification, meaning if you're doing a lot of walking, a lot of running, you're going to probably have to modify and decrease those types of activities. The next step are things like non-steroidal anti-inflammatories, Tylenol. Those are kind of pill forms. Some people also do physical therapy and or stretching, yoga, those types of things to try and increase the muscles around the knee to take the pressure off. Eventually, you can get to a little bit more invasive types of things like injections. Injections can include things like corticosteroids or steroids. They can include viscosupplementation. It's another type of injection that tries to increase some of the lubrication inside the knee. And then ultimately, there are different types of surgeries, arthroscopic debridements, where you put a camera inside and clean out the inside. But at the end of the day, the last resort is that knee replacement.
Somebody has the knee replacement. Is that knee replacement going to last them for a lifetime, or is it likely that over time that's going to potentially wear down?
That's a great question, Mark, because you're right. Nothing is as good as what we originally had in our knee as far as that cartilage. And most studies will indicate that knee replacements maybe last about 15 to 20 years, as long as the patient is really not too hard on it. But after 15 to 20 years, you're going to need what's called a revision surgery, which means you take out the lining of that was put in originally, and now you try and put in another one.
A lot of our clients have had really severe catastrophic injuries. They have what's either a below knee amputation or above knee amputation. Using this model, can you try to help explain to us the significance of those two different types of injuries?
So amputations, as the name implies, means you're basically cutting off a part of the leg, right? So below knee amputations have to do with, so again, we're looking at the model. The knee is at the level where the knee bends back and forth between the thigh bone and the shin bone. Below the knee amputation is below that part of the joint. In most cases, the surgeons like to try and, if it's possible, to do below knee versus an above knee amputation. And the reason is because the energy requirements for walking, even if after you have a prosthesis, are less than if you have an above knee amputation, which is above the joint.
If there's an above knee amputation, what's the significance to the person who's healing over time if they're trying to learn how to walk with prosthesis?
Right, so with a prosthesis and an above knee amputation, you're dealing not only with the knee joint itself, so a prosthesis is going to have that mobility where you have that bend in the knee, whereas the below knee amputation, the prosthesis doesn't require that. It can be just one part of the artificial part of the leg.
How often do you need to replace a prosthesis? Are they good for life, or do they wear out over time and need to be replaced?
So typically they can wear out. It certainly does depend on the usage. of that prosthesis, but over time, sometimes people can actually develop even a little bit of knee pain related to the cushioning at the end of that amputation. Oftentimes, it can also be related to the amount of bending back and forth, for example, with the above knee amputations. It really is patient dependent on how much they're using it.
Thanks so much for sharing.
You're welcome.